and welcome to our website. My name is Dr. Lee Barbach, and I am a chiropractic physician in practice in Miami for the past 32 years. Thank you for coming to us to look into your problems concerning Hashimoto's and hypothyroidism. And if you fill out the box, the blue box, just below, you will be able to get access to this free report on Hashimoto's and hypothyroidism within minutes. I urge you to read this report, as it could hold the answer to why you are still suffering with your thyroid-related symptoms. After you read the report, you will most likely want to take advantage of our free consultation, which is explained in the report. And so, if so, please call us at the number contained herein and ask to be scheduled for your free consultation to see if you might be a candidate for our thyroid protocols. Our two big areas of practice are hypothyroidism and Hashimoto's. And the reason we concentrate on these two areas is because many of our patients come to us after going to their primary medical physicians and not having the success and the results that they care to have. The traditional healthcare model for managing hypothyroidism and Hashimoto's is relied on one lab marker and one lab marker only, and that is TSH, thyroid stimulating hormone. Now, your doctor will look at that one lab marker to determine the efficacy of your thyroid treatment, even though your symptoms might not have changed. So if your TSH goes down following thyroid replacement therapy, and sometimes it does, your medical doctor is going to feel like they're managing your condition successfully, even though you still have symptoms. And let's say you still have symptoms of constipation, or anxiety, or nervousness and trembling, or hair falling out. They will then prescribe to you a specific prescription that is designed to treat the effects of those particular symptoms. Now, what makes us different is that when we put you on our thyroid protocols, the symptoms that we just discussed, the constipation and the nervousness, trembling, insomnia, hair falling out, different things like that, will all go away independently, and we will not refer you to a medical physician for additional medicines, because we are going to be getting to the root cause of your problem, and that will be described in more detail when we see you. And this tells us clinically that even though your thyroid is being managed with thyroid hormone replacement, the fact that your symptoms are still present tells us that the thyroid is not being managed properly. Why is this? The main reason is that 80 to 90% of all of the people, including yourself, out there that have hypothyroidism are probably a condition called Hashimoto's. What is Hashimoto's? It is a condition where your immune system is actually attacking your thyroid gland and killing it off little by little. So it's actually the body attacking itself. Why does the body do this? Well, most of the patients have a genetic predisposition to acquire and turn on the gene associated with this disease. Different triggers can bring this on also. It could be a food sensitivity, a bacteria, a parasite, a mold. Stress can cause this, or hormonal imbalances that will give you the chance to turn this gene on. Now, once these genes turn on, you no longer have a thyroid problem. It now becomes an autoimmune problem, and it has to be addressed properly. You can probably be assured that if you have Hashimoto's and your autoimmunity is not being addressed, that is why you are continually having thyroid symptoms. Even though your lab tests might be normal and some of the tests might be coming down into normal ranges, it is the autoimmune condition that is causing this problem to continue. In traditional medical treatment, if the autoimmune condition is not being addressed properly, then the patient will continue to suffer year after year, taking medication after medication. All the while the thyroid gland is dying off little by little. In our office, the way we handle this condition is to first determine if you have symptoms of both hypothyroidism and hyperthyroidism, which is a big clue to Hashimoto's. The hypothyroid signs are hair falling out, weight gain, inability to lose weight, constipation, cold hands and feet. And the hyperthyroid symptoms are palpitations, insomnia, nervousness, trembling. If you have a condition of these two types of symptoms, then there's a real good chance that you have Hashimoto's. Another sign that you might have Hashimoto's is that you are not responding well to traditional thyroid hormone therapy, and they have to keep changing your thyroid hormone dosage. In our office, we look closely into the immune system with our lab panels that tells us exactly how the immune system and how your other systems are working, and whether or not you have an autoimmune condition. We look at the T and B cell subset populations, and we also look at the cytokines, which gives us a close idea whether or not you are Th1 or Th2 dominant. This might not mean very much to you right now, but I want you to know that we will leave no stone unturned when it comes to diagnosing and managing your condition. So if you are interested in our free report, which explains more fully everything about this, please fill out the form below right now where it says your name and email address, and then you will get immediate access to this life-changing report. Thank you very much for your time, and we hope to see you in the office for your free consultation very soon.